Hello, everyone. Good evening to everyone, and welcome to join our live webinar today. And today we're going to talk about the roles of caregivers in handling or taking care of individual living with aphasia. So before we start the session, so we're going to wait for more audience to come in first. All right, and please share this video and please share this session with your friends and with your family members or your friends who might need this information. And while waiting for more audience to come in, let me briefly to introduce our Facebook page, Aphasia in Malaysia Facebook page. So this Facebook page is a platform for all the public, including the healthcare professionals and then the patients and also the family members or friends or even all, and also of course all the public, to discuss and to share the information about aphasia. And we also discuss all the challenges or obstacles that you might face along the aphasia journey. So, and we also welcome your successful stories. So, or if you have any successful tips or strategies when you're taking care of your loved one with aphasia, and we do welcome to hear from you. All right. And today we have Mr. Alvis. Okay, we have Alvis here. All right. And welcome him to join us today. And he's going to share with us on this topic and the roles of caregivers. Actually, when we are taking care of person or patient living with aphasia, we always overlook this aspect. We only focus on patients only. So what the patient can do, what the patient cannot do. But sometimes we overlook the most important part of the the aphasia recovery journey. Actually, is part of the important puzzle in the whole aphasia recovery journey for that patient, which is the caregiver. You see, and because as you can imagine, most of the time, whenever the patients with aphasia they can't do something, so who is going to do for them? So most of the time, it's a caregiver. So it could be the spouse, it could be the helper, it could be the nurses, it could be the probably the doctors, and also our speech therapists and other therapists and other healthcare professionals, or sometimes even their friends and family. So, and most of the time, they might face a lot of obstacles. You see, because most of the time we already have this long time habit of communicating with people. Well, we use our normal ways. So when a person has aphasia, so the communication skills are already different, right? Then how can the caregivers to help the person with aphasia, to communicate is a very challenging task, because like speech therapy is study, I still remember, recall my study time. So we are already using like at least 4 years, to just to study, all types of communication disorder. So what's more for a caregiver who has just got the so sudden news, from a loved one who has just got aphasia. So how are they going to change their ways of, taking care of their family, of their loved one with aphasia? There's a change of roles already, right? Like for example, some of the patient used to be a breadwinner in the family. Okay, so then suddenly he or she has a stroke, and then he or she got aphasia. Then now there's a change of role already. So then the other spouse will become the breadwinner, will become the stakeholder of that family already. So this kind of change, this kind of drastic change is really hard to imagine how hard they can overcome these obstacles. So today we are so glad to have Alvis with us and to share his experience, in handling the patients with aphasia, and how he can support the caregivers to overcome this aphasia recovery journey for that family. So without further ado, let us welcome Alvis. And Alvis, is a speech therapist, of course. Okay, not to worry about that. All right. So Elvis, so if you're ready, so I leave the stage to you.
All right. Thank you, Raymond. Good evening, everyone. Again, my name is Alvis, and I'm a speech language therapist. Today, like what Raymond has mentioned just now, I'm going to present the topic is aphasia, the role of caregiver. One moment. All right. So just a little bit about myself. I'm actually a graduate from speech science program UKM, and currently I'm working at a private rehabilitation hospital at Putrajaya, which I manage mostly adults with communication and swallowing disorder. For me, I strongly believe that restorative intervention is important, but embracing the new lifestyle is even more crucial in the rehabilitation. So, oh dear. Right. So there's an old saying that behind every successful man lies an amazing woman. I would like to make some changes and adapt from this quote by saying that behind every successful stroke recoveries lies an amazing caregiver, because you, as a caregiver, play such a pivotal and important role in the recovery journey. But just before I begin, I would just like to ask, what do we mean by caregiver, or who is the caregiver? So is that necessarily restricted to the spouse, the family member, friends, relative, or any private nurses or anyone? But to me, actually, it doesn't matter. If you are taking care of a person with aphasia, then you are a caregiver. So let me just mention that, allow me to introduce that. The goal for this talk today is I want you to try to understand what are the challenges and changes you are going through, and what you're about to go through in the future as a journey of being a caregiver, because I strongly believe that the first step in a successful stroke recovery is that we need to understand where is our standing ground so that we can plan for the further intervention without being lost in the journey. So let me just see over here. All right, I'm going to share an audio clip about an interview between a speech language therapist and a caregiver who has a husband who suffered from stroke several years back. I want you to really take a minute to listen to what are the challenges that she faced and try to relate back. Whether you as a caregiver, are you facing the same scenario? Or as a clinician, what do you feel about that? All right, just please allow me to play now.
Elvis, I think the voice is not so clear.
Voice is not so clear. Oh dear. Can you hear me? Wait, I'm sorry about that. You can hear, right? You can hear.
Just wait for. Can you play that again?
All right. Because I would like to know, is that no sound at all?
Yeah, no sound at all. Yeah,
No sound.
Yeah.
All right.
Yes.
Oh dear.
You tried again.
Let me just try to share screen again. I'm sorry about that. Right now. I'm sorry. Let me just share again.
No worries. Like, there's always a technical problem every now and then. So I believe some
things happen for a reason. Okay. I hope it's good.
Okay.
Let's try again.
So it's sorted. All right. Okay, let me see.
Can you hear now?
I can't really hear. Just wait for a while. So I'm sharing your screen right now. Just hang on.
Sorry, Raymond.
Not really.
I'm sorry. Can you hear?
No. I cannot hear that.
Sorry. Not really.
Not really.
There's no sound, is it?
Yeah. Or maybe I can share it here. Okay, I can share it here for you. All right. Okay, so no worries about that.
Okay,
so
it's okay.
We always have all these unexpected incidents in our life. So I believe some of the audience, those who have experience in taking care of individuals with aphasia must have faced a lot of unexpected incidents, even though you have studied a lot of books, talking about how to take care of person, living with aphasia. But, sometimes a lot of unexpected incidents could happen, you see. Like, for example, sometimes, when your loved one, they suddenly they give up of doing the rehab already, then what should you do? They don't want to talk already. What should you do, right? So now I think there's a technical problem, so Alvis left us behind. Okay, but never mind. So let me play the audio clip here. How long does it take for you to overcome this negative feelings? Yeah.
It's not overnight that you want to change.
Okay, yes. Okay.
Between his stroke, which is on February the 8th, it took me almost 5 months, to get over my own depression.
Sorry, there's a technical issue. I replay it again. I believe the volume is not so clear.
How long
does it take for you to overcome this
negative
feelings? Yeah.
It's not overnight that you want to change.
Okay, yes. Okay.
Between his stroke, which is on February the 8th, it took me almost 5 months, to get over my own depression. But
so yeah, when we're talking about aphasia, the communication difficulties, so as a carer, what are the challenges when you are communicating with an individual with aphasia?
okay, first of all, the challenges are within the patient himself.
Yeah.
Okay, so you have to manage his expectations. Okay, you also have to manage his frustrations. Okay, his expectations it's a psychological thing also, because he cannot understand why he cannot even speak. And I think they tend to be a bit locked in when they cannot speak. So that adds to the frustration. And on top of that, there's also the depression that sinks in when they get to be more aware as they come out of the stroke, and it gets a little bit better physically, then the mental part becomes more intelligent. Then you have to manage more psychology. So you really have to talk to him, just to tell him that it takes time.
Okay.
And also, we have to teach him never to give up. Because it was really painful when you're only talking about exercises for the face, and you're just telling him, when the brain itself is thinking, So you just have to tell him it's a stage by stage. But you also have to manage yourself. The challenge is also to remain positive, remain patient. It's very easy to say that, but you also have to educate those people around you not to laugh or ridicule him. That's one thing I find that very sad for him. We have other carers for other patients in the ward, not in the ward, in the gym that my husband goes to. My husband can only speak talk.
Okay.
Okay, it's just up tone, down tone, angry tone, because he has no other language. The maids call him, the other maids from other carers, other patients will call him the man. Okay, whenever he they just laugh and they giggle. So that adds to his anger. It's like he's embarrassed that he's only and then after one stage he wasn't talking. He wasn't jawing at it even. So I have to manage that. I have to explain to that particular need. It's a very sad thing that he cannot speak because that's the only sound he can make because of that muscle deficiency.
Okay.
I'm going to control the slide for you, Alvis.
All right, sure. So there's two things I'm going to address at this moment. First is my sincere apologize. I'm so sorry about this technical error. Okay, I'm so sorry about that. And second thing I want to say is I really want to take this opportunity to express our gratitude to these amazing caregivers for giving us the consent to share her experience with everyone in the public. because after listening to the experience that she has, it really enlightened me and let me understand more about what we as a clinician should be more sensitive towards the surrounding. Because as a clinician, sometimes we get too engrossed in dealing with an impairment, but sometimes we've forgotten about the environmental aspect that is causing the stress in the person. Like, for example, if I didn't listen to this experience by this amazing lady, I never know that there's so much stress going on in the environment. So that relates back to what I'm going to present to you, is that we need to try to understand what is actually happening in the environmental aspect and how it links back to our management. So by listening to this one, I just want to say that I really learned a lot from you, the caregiver, the amazing caregiver. And I really hope I can see that you really care a lot about your husband. You can see you understand a lot and how to support your husband. I wish you continue to flourish in a therapy session. All right. So next page, please. All right. Because how do I put it this way, is when a person is been diagnosed with having stroke, or afterward we have aphasia, it is not only the person changes the life, it's actually the whole family member, everyone around the person will be involved in these changes, because you will never face the aphasia alone. So some of the problems that I saw that in my caregiver is that mentally we feel stressed. Another one is taking care of the person. Sometimes they will feel emotionally disturbed. They will have altered feeling and affected emotional well-being. And lastly, physically, they might have deprived sleep quality because of all the time they spend in taking care of their loved one. They will have reduced energy level, lethargy, and experienced some physical discomfort. All right, moving on. So, and the biggest challenges in my experience is that caregiver will have a big problem in communicating with their loved one. This is the main problem. And second, by adjusting to the dependency. And another one, the big topic is to motivate the person with aphasia to continue in the intervention. So after talking about all these challenges, we need to understand what are the changes that happen actually. Next slide, please. So what are the changes that actually faced by the person with aphasia, and you as the caregiver is important. So let's have a look. What are the changes? According to the psychology, there is actually a few domains. We need to look into it. Why I'm presenting this topic to you? Because a lot of time we would just say that, oh, because he has a stroke, he has an aphasia, so of course he is emotionally disturbed, he's stressed. But what I want to do now is why he's feeling stressed. That's the question. Because without knowing what is causing the stress, we will not make any changes. He will continue to feel the stress. I mean, the loved one is in stress, is in distress. So how do we do it? So there might be 5 changes. This is just an example, the 5 main changes that's happening. One is the identity switch, relation changes, affected career and financial, affected health, and also mental and emotion. So let me just explain by giving you one example, is that previously I have a client, a lady, a successful business and entrepreneur lady. So before this, she is the leader of the family. She is very formidable. She makes all the changes, all the decision, big decision is made by her. And she has a very nice relation because she's a very outspoken lady. She always go out, have a social gathering with friends, very nice life. And she has a lot of big project coming up. And financially, amazing. I can just say amazing. And she's very sporty and very happy. It's just an amazing life. But out of the blue, in a split of second, she developed a stroke. And after the stroke, she was diagnosed of having aphasia, which means that she has problems speaking and reading. So first one, let's go to the identity. I want you to really follow me and try to think how all these domain changes ensue from the stroke. For the identity, previously, she was the leader in every aspect. But just in a split of second, because of the problems in communication, she unable to make all the big decision. So all the decision was made by her family member. So the identity switched from a leader into a dependent. So it's too sudden, to be honest, it's too sudden in just 1 week time. So you can see that she's uncomfortable with these changes, which causes stress. So this is the first part. Moving on, she is a very outspoken lady, but after the incidents, when the friends come pay for the visit, the friend noticed that she struggled when she tried to speak because she couldn't find the word or the pronunciation is not clear. Because of that, I believe that the friends actually comes in good means. They don't want to trigger her. They don't want her to feel low self-esteem. So they decided not to visit her. So because of this, she faced a lot of stress going on because the relationship between her and the friends is not good as before, or should I just say, has changed. So you can see that because of this, she becomes socially isolated. And one of the things I want to highlight here is that when a person was diagnosed with aphasia, they will have, yes, they have problem with communication, reading, writing, speaking, listening, but they have no issue in IQ, meaning they are completely aware what is going on. So when the lady know what is going on with the relationship with the friends, she's feeling uncomfortable again. Career and financial. Previously, she has a lot of big projects. She's a bright future in front of her, a lot of things to achieve. Because of this event, everything have to put a full stop. Can you now understand how devastating it is? And financial part, because of the injury, the stroke, she spent her saving, her saving on the surgery and never-ending therapy because she needed physio, OT, dietitian, and a lot more. So it's depleted for that part. And for the health part, there's a lot of different aspects going on. For example, it is quite common for a patient with stroke who develop a neuropsychological pain, which causes very uncomfortable or frozen shoulder going on. So she's in pain. And all this is interrelated, which somehow exacerbate her mental and emotion. So can you see that multiple domain has been affected just because of stroke? And we, as a caregiver or a clinician, can never say that the patient is, should I just put my client or my loved one is in distress because of the stroke and full stop. No, we shouldn't do that. We should try to analyze and make changes so that we can alleviate the problem. For example, just take one example, relation part. Like I mentioned, the friends gathering. Like I say, I'm not judging the friend or so on. I believe that actually the friend comes with a good mean. It's true. I saw the friends actually. But what we can do as a caregiver, part of our role, is we need to explain to both the client, your loved one, and the friends about this condition and teach them how to really communicate and how to remove your loved one from the isolation. So by doing this, we can alleviate the stress and shield from the relation part and so on for each and tackle each and every aspect in this one. So this is one of the example I give you. I hope that you can try to spend some time, check back this slide afterward because you can keep on replay in the Facebook group, but try to relate back how you can help. And another key feature over here is that these changes, like I say, it doesn't apply to only your loved one, but it applies to you as a caregiver. I want you to try to think after your loved one has suffered from a stroke or the aphasia, how it changes your identity, how it changes your relation with the person, and so on with your career and financial, your health, your mental and emotion. That's the most important thing because our mental health is very crucial also. So let's move on to the next slide. So I want to introduce another one is the very famous grief cycle proposed by Dr. Kubler-Ross is that when a person go through the grieving process, he or she will go through the 5 stages, starting from the denial, anger, bargaining, depression, and acceptance stage. The final end goal that we want to achieve for all the patient is the acceptance stage. So that now we understand we are at this level and what should we do next. That's our ultimate goal. And one of the things I want to emphasize over here is that for this grief cycle, it's not one way. It's actually cyclical, meaning that for today, maybe you have reached the acceptance stage, but the next day, you might go back to the anger stage, and it's completely normal. Because like I say, it's a cyclical. Today, you might face, yes.
So meaning that sometimes caregiver will feel like they think that they sort of know that they already accept the truth that his or her spouse has got a stroke, has got a aphasia. Then suddenly the next day become very down already. Then the next day become very happy. So there's a up and down fluctuations of emotions.
Exactly.
Right?
Exactly.
So, yeah.
Mm-hmm. So you will have ups and down moments, and it will fluctuate. To be honest, it will fluctuate because you have known your loved one with this identity, with all this condition, good memories for your whole life. It is not fair for you to say that you will accept the changes in just 1 month, 2 months. It's too short. So it's up and down.
Then how can we help the caregivers to make them accept every day? You see, make it flat, not up and down. Anyways.
Oh, I see. Okay. Never mind. If we want to target that one, there's a role coming up in the next presentation. But just another one. Wait. Sorry, can I go back?
Oh, no, yeah. Okay, sorry.
Yeah, it's okay. Another thing is that we will say, we always say something like that. Times will heal everything. I know it's not a good saying, and this one, not everyone can accept this one, but it's so true actually, is that when times goes over, when over time, I'm not saying that when you will finally reach the acceptance stage for your whole life. No, it's not going to happen like that. But next time, when you go back to the beginning of the spectrum, like the denial stage, it will be faster to reach the acceptance stage in the next time. So one of the things here is that when the going is rough, always remember the good memories because time will heal. All right?
So meaning that the mindset of the caregiver is very important. So every time when they feel very sad, I think the mindset should be very positive, thinking that, okay, so my husband or my wife is totally original himself or herself, but just because of the illness, so might cause a lot of changes. But I think, like you say, I think the mindset is very important. I think the time over time, then it will heal the problems.
Yes, exactly. Yeah, we always encourage positive thinking. But of course, if sometimes, any moment, if you feel like you hit a low, it's perfectly normal to just stop for a while. This is how the presentation is about, to let you understand it's perfectly normal what you are going through right now. But just remember, after you take a break, you need to stand up and continue the journey. All right?
Phew, I think caregiver is very stressful already.
It's okay. Don't stress.
Hey, I fall. The caregiver might think, hey, I fall down. You want me to stand? Is it? You think it's easy? Not easy, You come and fall down and see.
Yeah.
Right.
So sometimes I agree. It's not fair for us to say that what you should do, but just we are sharing what our experience and hope that it will help.
All right. Okay. I believe they are very excited to listen how can they overcome this challenge.
Oh dear. Okay. We can do it. So now let's see how can we overcome the challenges. The first one, like just now I show you that most of the caregiver will report that they have problems communicating with the loved ones. So how are we going to do that? One thumbs of rule over here is that communication is not just restricted to speech. Communication is everything. as long as you are able to understand what your loved one is saying or or how your loved one is expressing the idea. So there's some of the method, because when your loved one is having problem in speech, we can use some alternative method. This is what we call the alternative and augmentated system, or we call AAC. So I just give some example that's more than that. For example, on the top part, you can see this is what we call the alphabet board, just a list of alphabet. So it's easier for your loved one to just point to the alphabet. The second example is a communication board, because sometimes for person with aphasia, they might have the problem in identifying the symbol or reading and writing. That's why we have prepared some of the symbols over here. It will go through a different processing route in the language. So it will be easier for your loved one to express. Or another one is through writing and drawing. So if you wish to know more about the alternative and augmented or just alternative communication method, do visit or do check out our previous webinar in the Aphasia in Malaysia group entitled the Alternative and Augmentative Communication. All right.
Thank you. Thank you, Alvis, so much for advertising our Facebook page.
Disclaimer, I didn't receive any publicity fees. All right.
Thank you.
Next one.
Yeah.
So other than the alternative method, there are some additional strategies when you have problems in communicating with your loved one. First, when the communication breakdown occurs, please acknowledge for both of you, you as a caregiver and the person with aphasia, we need to be on the same page, that knowing that now we are having a communication difficulties. Let's try to fix that. All right. So maybe previous your loved one is an amazing artist. So the drawing is amazing. It's fantastic. So try to ask him to draw out what he's trying to say. Or another one, you see, like I'm talking, I will use a lot of hand gesture, my facial expression, just to help me express my speech. So if this is working, it helps you to understand more what your loved one is trying to say. Just use it, because the main idea here is just get the message across. All right. So, and the following this is that never pretend that you understand what your loved one is saying. If anytime you feel like you are not clear with a message, verify it by asking the patient, just now you were saying that like this, like this, like this, yes or no. You can use thumbs up and thumbs down for this part. And another one is that try to eliminate this distraction. Maybe sometimes the moment where you cannot understand or the communication breakdown occur is actually due to the environmental noise. So maybe you can try to just turn off the TV or try to speak in a quiet room, and you will see the difference. Always speaking in a normal voice and volume. Be patient, don't interrupt. And the last part over here is avoid asking testing question. In another word, don't ask question that you already know the answer. My personal experience is that I always have caregiver that will ask the patient or ask the loved one, what is your name? For example, my patient name is Mary. So because she has aphasia, so she'll answer something like Maddie. And when this happens, the caregiver will reply, no, try again. Your name is not Maddie, it's Mary. Mary, try. And the loved one will say Maddie again. And it will goes back to the caregiver, and the same thing, back and forth, will sustain for 5 to 10 minutes. So just go back to the first part. Let's try to analyze it back. Why this will happen? Because research has shown that when a person has aphasia or the communication difficulties, they are aware when the communication breakdown occur, but they have problems to actually repair, or we say, sorry, go back, please.
Sorry, not yet finished. Okay.
Where will be okay? All right. They have a problem in correcting themselves. So when this happens, right? So you can see just now for one question, it already lasts for 5 to 10 minutes. It's very, how do I put it? It's very tiring. It's very tedious for the person. But if we just look back, can we avoid all this? Can. The answer is can. Because what triggered this prolonged testing is the question that we already know the answer. What is your name? So like I say, I'm not judging anyone, but I'm just giving a suggestion over here is that instead of keep on asking the person to repeat the same thing over and over to correct him at the moment, why not? We just do it at a specific time frame. For example, 1 hour per day in that particular time slot. This is the time for us to practice your speech, to practice your communication. So that's the time where we can communicate, where we can correct it. But in the other time, just
Sorry, Alvis.
keep it.
Sorry.
It's okay. It's okay. Remove distraction. All right. All right. So in other times, just keep it going. Because another one is that I want to be one of the message I want to send here is our loved one just been through a very traumatic event. So being this, he's a wife. So another thing is surviving and actually living is two different things. So they just survive from a very, very traumatic event. It's our job, it's our role as a caregiver, as a clinician, to make their life worth living. So how do we do that? One of the things is we want to make the environment friendly. We don't want to keep on testing them. In this way, part of it will actually improve their motivation. And for the curve cycle, they will reach the acceptance quicker. All right? Yeah, I go back to the question.
So if let's say we
Yes.
don't ask testing questions, so what kind of question the caregiver can ask so that we can create the very friendly aphasia environment? Not easy though. So what kind of questions you will suggest to the caregiver instead of asking, what is your name? So what other things that you think, the caregivers can ask or can talk about in order to make the whole environment is very friendly?
All right. How about like this?
Yeah.
Just don't remind yourself that your loved one is a person with aphasia. Think that person as a normal being, like the conversation I'm having right now. If you go out to have a conversation with your friends, are you going to ask them, what is your name? What is this? When you reach a cup, what is this? No, you're not going to do that. You are just going to, you will tell stories. You will share your feelings. You will just have a friendly conversation. This is what I want you to do actually with your loved one. Yes.
Yeah, of course, while saying all the leisure topics of the conversation, I believe we still have to use some of the strategies that Alvis shared here, like using gestures, yes, no questions. Yes. Yeah, just the topics of conversation, even jokes. I believe the caregiver still can share with them.
Yeah, of course.
Yeah. Okay.
Make their life happy. All right.
All right. Okay.
So for the motivation, is that I believe this is one of the big topic that all the clinicians will go through. Maybe the first few sessions when we see the client is very motivated. They want to do everything. But as the session prolong, unfortunately, like for months, then there's a high chance that it's very common for us to see our client will been through another phase we call apathy, where they are not motivated. They don't want to do everything, but the caregiver will insist to do. So how do we do that? How do we motivate our loved one to continue with therapy? It's not easy, but if the caregiver, which is you, can do this and help us with this part, it's really fix the missing puzzle. It really helps us to continue with a therapy. So first thing, my suggestion is we as a clinician, of course, and the caregiver should really understand and able to explain the nature of aphasia. You should try to learn and try to explain what is actually happening so that for the clients, for your loved one, they will understand, all right, I'm not able to speak for now. It's because of the stroke. So it's okay. It's perfectly normal, but I still have some words that I can say. That's very good. We are just going to try to make changes so that we can continue to move on, so that there's more words that I can use in the future to express myself. It's doable, but just you need to continue in the session. This is something we can do. We can explain to the person. Next one, like I mentioned before, provide assistance in the communication, create a friendly environment, and let's embrace the new norms together. The third one is the caregiver. One of the role that you can try to do is please attend the therapy together. Because as you attend the therapy together, you will show to your loved one that you are important. And doing the therapy is important for all of us, for all the family member. And
So what-
also you will be...
So sorry, what I have a
Yes.
question here. So what if the caregiver is very busy with their work? You see, I have no time. So every time, so I drop my loved one so to attend the session. I have no time for that because I need to earn money to pay your session. So what? Then how can they do? They cannot attend already.
Yeah, I understand. It's completely normal also actually because of the financial. Remember, go back to the changes. The financial is a big topic. So if this is the thing that's happening, first of all, I will not also say that you must attend the session because of that, because it's not fair to you and you will feel the stress also at the moment. But what I'm suggesting you to do is that whenever you are able to arrange the therapy session during your free time, just try to attend, okay? We take a small step at a time. Just try. But if you are really unable to attend, it's okay. Never mind. We have a lot of things that we can try. Is that you can just give a call to the center. At least I want you to understand, or you can have a talk with the clinician to understand the progress and everything. Because the most important thing over here, one thing is to share that you care. Another one is for you as a caregiver to really understand what is the goal of an intervention and how is your performance of your loved one during the session. So to conclude, it's understandable if you are unable to attend all the therapy session together, but just try your best to make the best out of it. That's the thing I'm trying to suggest.
So actually, I think the caregiver can always discuss with the therapist how we can make things out, right? So there's no like fixed formula, you should do this and that.
Yes,
a lot of solutions like Alvis say, call to the center, or sometimes, video recording can be also alternative.
Yes.
And some of them, they do conference call, to discuss about the patient's progress regularly. I think this is also workable. But there are a lot of other ways, I believe. I think the caregivers can always discuss with the therapist. So no stress, caregiver. You are all amazing.
Yeah. No stress, be happy, all right?
Yes, this is very important.
So just now Raymond really mentioned a few good points. Is that have a video call and so on, like what we are doing at this moment. Because of this COVID-19, the boom in technology, everything is possible with technology nowadays. Just that we have to take the first step. And so this is one of the things that we can do over here. But if anytime you feel like there's something disturbing you, all right? I mean, mentally, something is too negative happening. So always please seek advice from the professionals like clinical psychologists, counselor, or psychiatrist if needed, because it's very common to receive some counseling from this traumatic event for both the caregiver and the loved one. All right. So let's move on. So the main message over here is that you as a caregiver are important too. It's true. Like, for example, I really appreciate that, like just now when we discussed about the topic that if you are unable to attend the therapy session, what should you do? What should you do? And all that, right? But look at what you are doing right now. This is not your working time, but you are actually spending extra of your own time to listen to the talk. It shows that you are really trying to help your loved one. So this is a very good step already. So, but again, you are important too. So let's move on to the next one. So I want to leave you some advice is that as a caregiver, we cannot be too engrossed with just purely therapy, taking care of a loved one. We need to have some better time management. For example, you need to slot in at least 1 hour per day to have some me time, which you can utilize the time to connect with friends, family, and support group. Like you can reach out to us, the Aphasia in Malaysia. That is the main purpose of this Facebook group. Or you can practice some relaxation technique, like you can try some yoga. It helps with some of my clients, the caregiver. And another one, please have a healthy and balanced diet and practice healthy sleep hygiene. Because if you also fall sick, who is going to take care of your loved one? So you are important too. Remember this one. All right, next one.
So how is the relaxation? I mean, how the relaxation treatment for the caregiver to attend? How can they help the patients with aphasia? After practicing the relaxation treatment.
Yeah, and that's a good question. Is that sometimes when we are stressed, we cannot make good decisions, isn't it? And another one, like I mentioned, our loved one who has an aphasia, even though they have an aphasia, but their cognitive is intact, meaning that they can understand what everything is happening. They can sense your emotion. So the moment when you are feeling stressed, it will be much more stressful for your loved ones who is gone through this event. So when as you practice the relaxation technique, you will soon to see help, and soon you will see the light side, the bright side of all the things that happen to you, and you can continue this journey with full motivation with your loved one. All right. So this is one of the good things about relaxation technique, and every one of us need this one.
Okay. Yeah, definitely. All right.
All right, so this is the end of my talk today. I hope that you learned something from me. I hope so. But just, another thing is that I will just end here by giving some advice is that please, caregiver, you guys are doing an amazing job. True, it's true. You are really doing an amazing job and you should be proud of yourself. Just remember, grow through what you go through. If anytime you feel tired, an emotion about this is completely normal, but learn to take a rest and not to quit. So please continue with your journey. I'm sure you can do it. All right. Thank you.
Yeah. Thank you, Alvis, for his informative sharing about the roles of caregiver, in taking care of person with aphasia. And I don't see any questions from the floor at the moment. But I think I can ask on behalf of the audience or also caregivers, some of the challenges that you all might have faced very commonly during the daily interaction or daily activities with your loved one is that sometimes when you want to practice the speech with your loved one, you see, sometimes they will they're so frustrated with their own mistakes, with their own failures. You see, I cannot speak. That kind of face. Probably, maybe they cannot say, "Oh, I cannot speak already." No, I don't think they can. Some of them, so they will just show their frustrated face. It's like hopeless face.
I'm sorry, Raymond. Can you try to repeat again?
Sorry, can you hear my voice?
Sorry, Raymond. It sounds a bit choppy for me. I think it's my network. Can you try again? Sorry.
Okay. Can you hear me? Can you hear me? Can you hear me? Hello. Can you hear me? Can you hear me?
Try again. Yes.
Can you hear me?
Yeah. Can.
Okay. All right. I think. Okay. So yeah, that's the thing. People living with aphasia must have faced a lot of frustration with their own errors, and sometimes when you want to give them motivation, okay, you try it again. Then the patient will like, like that. Those kind of frustrated sounds. You see. So how can the caregivers to continue, how can they make things better?
All right. So you're saying that when a lot of times
Yeah.
the client will feel frustrated
Yes.
with all the sound, the sound and all that. And it might be very stressful to the caregiver also, isn't it?
Yeah.
Sometimes they might feel that why my loved one is in this situation. They might blame themselves. Am I pushing them too hard in this scenario? So how to continue the journey with all this sound? It's actually quite normal. But again, the first thing is that try to understand why he's making this sound in the beginning. So a lot of times we will think that doing the therapy is good, it's really improving, but maybe the person with aphasia, they are not feeling it. They are not on the same page. They cannot see the improvement. It's very common for both physio, OT, and everything, every other treatment. So the thing that I'm trying to say here is they don't have a sense of accomplishment from the therapy session. That's why they will feel tired, they will feel boring, they are bored, and they don't want to continue. All right. So one thing is, I can assure you, you as a caregiver, you are not doing the wrong thing. All right. You're doing a good job. So please don't question yourself. What we can do, or what I can suggest to do better, is that let's list down together before and after the therapy session. Like before this, maybe you can only say a few sounds, and then a lot of times you cannot understand what I'm trying to tell you, or you cannot write at all. And just after 2 weeks training, you can see the difference, or I don't know, months of training. You can see how far you have reached. So you need to list down for the person with aphasia or your loved one, for them to see, so that they will understand that they are really improving actually in that sense, and they will continue to motivate in a session. And I'm sure that after you do this a few times, then they won't make any of this fuzzing sound, and they will continue with the session.
So meaning actually, what Alvis has suggested is that the caregivers should highlight the small victories, so even the tiny, very tiny victories, and also sometimes these tiny victories, caregivers might not see it themselves. So I think discussing with the therapists regularly, I think this will be very helpful. And then celebrate the victories together with the therapist. Yeah, I think that would be very helpful. And I can see there's one question from the floor. So let me pose the question first. So thank you, Chongming, for your questions. I think his question is about how do you help in someone with global aphasia besides being supportive?
Right. So for this one, when we as a speech therapist, when we are managing a clients with aphasia, we need to see multiple aspects. So first one is, of course, the environmental aspect, the caregiver aspect, and also a lot of barrier, but the last one is impairment. So now you're saying, Madam Chongming, is it? So you're asking besides...
How can, besides being supportive, how can we help with them? Global aphasia is, for audience who do not know what global aphasia is, global aphasia is a type of aphasia that affects the understanding and also expressive skills of that person.
Yes. So sorry.
Yes, please carry on.
Yeah, I understand that when a person has global aphasia, it's very difficult for us to communicate with the person. Yeah, I understand it's a struggle. So now, other than being supportive, I believe that you want to know more about how we can communicate with a person. One thing we need to bear in mind is that when a person has global aphasia, the first intervention should always focus on the understanding part, because for the understanding will go off first. So for the global aphasia, what I'm trying to tell you is we need to work on the understanding. And as you can understand more, then you can communicate back more. So for that one, we need to consult with the speech therapist who is seeing the patient. And another one, I just want to share with you my experience with the global aphasia is, I have a patient coming from Kelantan, global aphasia, and she cannot understand what I'm saying. He cannot say any words a lot, but he's completely aware of his own struggle, of his own, I would say, communication breakdown. So how do I help in that moment is that besides doing the impairment therapy, like just now I mentioned to you, improving the understanding, I try to do something that he can do previously and he do often, frequently previously. For example, he is a Muslim. So what I do in that session is that I try to do the recitation with him. When he do that, he actually can do it. You will be surprised because this is the automatic task. And at the moment when he do that, he will feel he has accomplished something. And before he enter my session, he keep on crying because he want to say something, but he cannot say it. It's very it really breaks me actually into a paroxysm of tears when this happen. But after the session, after we just do the automatic task, which is just reciting, and then I just ask him to can you count for me Monday to Sunday, something like that. When a person with global aphasia is able to do something, it will prove that themselves they still can communicate with other people. And when this happens, you can see the moment they laugh. It just means the world to you. So what I'm saying here is for the impairment base, we need to continue to monitor with a speech therapist. But for other things that you can try to do is just try to do something that you think he will enjoy previously and make him feel happy. It takes time. All right. I hope that I answered your question.
Yeah. All right. Okay. Thank you, Alvis, for your suggestions. Yeah, I think a lot of ups and downs feelings. The person with aphasia, that they will definitely face that. I think most important thing is like what you say, highlight the good things, highlight the happy moment, highlight the the victory.
Yes.
Yeah, I think that's a very one of the sustainable ways to keep them motivated. Yeah, and always we also have to let them know that the failures is normal during the aphasia recovery journey, I think.
Yes.
And most important thing that whenever you face the failure, whenever you face the sound errors or any paraphasia you make or any word finding difficulties, that you face, always once you make the mistake, you just let it go and keep on trying, because this is part of the brain recovery process. So we can't really control our brain completely, sometimes.
Yes.
So we have to, face the failure, bravely, and then we let it go fast so that we can keep on moving. If let's say we keep on being trapped in that errors, in that sounds, or in that sad moments that we had, it's hard for us to keep going, right? So yeah, I think that's a great lessons, for all of us therapists, patients, and also the caregivers to learn, this aphasia recovery journey. Yeah.
Yes.
All right. Okay. All right. There's another comments from Chong Ming is that he found more therapies concentrate more on the swallowing part rather than speech part for stroke patients. Yeah, yeah. What do you think about that? Swallowing part is also part of the speech therapy's role, but of course, this Facebook page is about aphasia. We don't talk about swallowing, but of course, we can talk. We can discuss about this. Yeah. What do you think, Alvis?
So sorry, I don't get the question. Can you come again?
Okay. Actually, Chong Ming, right, has found that most therapies concentrate more on the swallowing part rather than speech part of the stroke patients.
Okay. Yeah, that's another topic actually, is that for us working at a health setting and for aphasia patient, let's say a stroke patient, 1/3 of them will have swallowing problem. And a lot of times is that for the swallowing problem is more important to some of the therapists, because it's true actually, is that we need to get enough nutrition, enough energy so they can continue to motivate in the session. But sometimes we need to work on communication, which is now what we have discussed throughout the session. So I'm not saying that the therapist did something wrong and so on. I believe that the speech therapist has their own focus, and which is true also. If your loved one have swallowing problem, and we need to find what we can do and will benefit the whole family the best in a short period of time. So yeah, sometimes I will work with both swallowing and communication.
Yeah, I think if let's say some of you are really cared about speech, some people concerns priority is different. Some people feels that speech part is more important than swallowing part. You can always discuss with your therapist. Is it workable to do it concurrently? Is it workable we do the speech first, we do the swallow, or we do the swallowing later, and so on? Things like that. It's very flexible. So we can always discuss with the therapist. Then you will come up with the consensus among all the parties, so everyone is happy. And this kind of environment I believe is also one of the friendly environment for patients, because he can feel the vibes, the positive vibes from the therapists and also the caregivers, because of the happiness they come together, you see. So I think you can always discuss with therapists, right? Okay.
And for Zhongming, just one remarks to add is that for caregiver like you're also part of the team.
Yes.
Yeah. So I'm sure that the speech therapist or the rehab specialist, they will value your comment, your feedback very much. All right.
Yes.
Please discuss with them.
Yeah, we do want to listen feedback from caregivers sometimes, not only us doing the decision. And sometimes I think most of the time caregivers are the best person to describe the person with aphasia. We are the supporter, you see, sometimes. All right. Okay, so thank you, Alvis, for your suggestions and your sharing. And I believe audience has got their, has got the some very important and useful information from this session. And hopefully, as a caregivers, be it as a spouse or as a parents or your healthcare professionals, or even just a friend. So don't always feel so sad that you cannot help your the loved one with aphasia. Always be positive. Make use of one of the strategies that one of the strategies that Alvis has shared today, consistently and regularly. I believe the consistency and the persistency will make the huge change in the person with aphasia over time. So don't ever give up, I think. Yeah. And
yes, agree.
Yeah. All right. So I think that's all for today's session. And coming up session will be in 2 weeks' time. We're going to talk about, there's a trailer here. We're going to talk about chronic aphasia, meaning if a person suffer from aphasia for a long period of time, so we call it chronic type of aphasia. So how can we help them to overcome this prolonged period of recovery journey? So please stay tuned with us, and we see you all again. And have a good night. Have a good weekend. And thank you, Alvis.
Yeah, thank you.
All right.
Yeah,
Okay.
bye, everyone.
Bye-bye.